Throughout the month of September, which is Suicide Awareness Month, we support and encourage everyone to find time to take care of their mental health. And today, we're talking about veterans, and we're working with a medical expert and former military flight surgeon about therapy to treat veterans with PTSD and severe depression. We want to welcome to the show now Dr. Zaid Fadul. Doctor, thank you for being with us.
Thank you for having me.
Can you explain why you use ketamine therapy to treat veterans and why this controversial drug is so effective?
Sure. I would say, though, that I don't think ketamine is controversial. It's been around for 60, 70, 80 years with a very, very large safety profile. But we've been using it for depression and PTSD because one of the things that happens with those issues is that people can get very paralyzed. And PTSD in particular is very isolating, and patients feel like they don't really have a way to move forward. Ketamine is a very safe drug used to help patients essentially dissociate for a small period of time, allowing them to approach some of the issues that developed to their PTSD. Trauma is a big, big issue for a lot of veterans, and these episodes are hard to deal with without the right support and the right guidance.
And Dr. Fadul, we just talked about the ketamine therapy. It's been in the news recently following the death of actor Matthew Perry, and they specifically said that he died from an acute effects of ketamine. What do you say to people who are concerned about the safety of the treatment, especially for our veterans?
I recognize all the tragedy that surrounded Matthew Perry's untimely death. I would say that ultimately, like with any medication and any drug, it has to be done under the right supervision and with the right support and guidance. Mr. Perry was very, very poorly served by the people around him and by the providers that were working with him. In the end, if you have the right support staff and the right treatment plans and the right supervision, patients will do extremely well.
And Doctor, I understand that you're still a reservist. You're still serving?
Yeah, I'm actually flying up tonight, as a matter of fact, for my reserve duty.
All right. Well, thank you so much for taking time. Thank you for your service. Thank you for taking time to be with us and share more about treatments for veterans. We appreciate it.
My privilege. Thank you. And
if you are a veteran who's watching right now, or maybe you have a loved one that needs help, Illinois does offer a 24/7 confidential hotline. You can dial 988, then you press 1, or you can just text 83825 for that confidential crisis support.